Vidal here of Pure Plastic Surgery. I'm with Raquel, our anesthesia provider, and today we're going to be talking about immediate post-op care, recovery, anesthesia, and the first 24 hours after surgery.
Hi guys, like Natalia said, Dr. Vidal said, my name is Raquel and I'm the CRNA or the nurse anesthesiologist here at Pure Plastic Surgery. And I wanted to speak to you guys specifically about pain management because it's something that has come up a lot in the past. So I wanted to talk to you guys about the medicines that I use here to control your pain. So first of all, I wanted to show you guys this board I made, and just wanted to talk to you guys about the different types of medicines that I use. So first I use narcotics. So I have fentanyl, sulfentanyl, and then Demerol. In the OR, in the intraoperative period, I have sulfentanyl, which is 10 times stronger than fentanyl. And that is very strong, and that should take the pain away. And when I wake you up here in the operating room, you guys don't remember because this is really strong. When we go to the recovery room, then you start to wake up, and it is surgery, so I can't guarantee that you're gonna wake up with a pain of 0 because we're doing surgery. But my goal is to have you guys have a pain that is tolerable, so 3 or 4, and then I can treat that pain with fentanyl, or I like to use Demerol too in the recovery room because it helps with the shivering, which is another side effect that anesthesia has. And then when we get closer to going home, I stop giving you narcotics because I want you guys to be awake for your car ride and for the hotel. So I try to use the non-steroidals, which is Toradol, which is also used for moderate to severe pain. So that should help also as well.
Exactly. So it's the important thing is that it's not one pain medication, it's more a combination of things. And when you see pain management in the post-surgical patients, it is better to be treated with a combination of things. And sometimes the patients wake up and they only hear that we gave them Toradol, and it's like that's an NSAID or a non-steroidal, and they think it's not strong enough. But the thing is that, like Raquel said, we've given you a bunch of things to be different from a hospital setting. In a hospital setting, if you don't wake up, you stay overnight for monitoring. Here, this is an office-based surgery center, so you have to go home. So the safety is the #1 priority for us. So you have to be awake, breathing, and be able to protect your airway. So it's a combination of being comfortable with your pain, but also that you're safe to go home and spend the night in the hotel, Airbnb, your home, or wherever it is that you're spending the night, okay? So like Raquel said, this is the pain scale that we refer to. This is a common thing you'll see in hospitals, you'll see in the operating rooms, and it's basically to standardize pain. Pain is so subjective and so different from person to person. 0 is no pain, like I'm standing here without any pain. We're not going to send you home with a 7 to 10 pain, but we can also send you home with a 0 pain because you're also in the post-op period, you just had surgery. So the goal is to send you home in between 3 to 5. You also have narcotics that I'm going to prescribe to you, Percocet, that you'll have it at home. So it's a combination of what we gave you here, and also you continue with the pain management when you get to your hotel, home, Airbnb with the Tylenol and Percocet. And those first 24 hours usually are the roughest, but with this combination of the Percocet, most of the patients are very well tolerated and they're okay with that regimen. And most of the patients by day 2 or 3 are almost with no pain. They say usually with a Tylenol only, they're okay. Sometimes I take the Percocet still for the massages, but most of the time by day 3 to 4, they're without any narcotics, which is the goal. Any questions, any concerns, the first thing you should do is call our office, okay? Sometimes that first night, that day after surgery, we get nervous, we start seeing your heart rate a little bit high, and the first thing to do is call the rapid response 911 emergency number. The thing with that is they're gonna take you to the nearest hospital, which I might not have privileges in, so I might not be able to see you there, okay? So if you're awake and you have any questions before calling the emergency line, call our number. But what if it's 2 a.m? It doesn't matter. No matter what time is it, someone is gonna put you in contact with one of us, okay? So if it's working hours, a receptionist is gonna pick up and they're gonna get one of us, either me, Dr. Earl, one of the nurses, right on the phone, okay? If it's not working hours, we have an answering system and they'll put you in contact with the person that's on call. It's either me, it's Dr. Earl, our nurse, registered nurse, Sarah, or nurse practitioner, Jenny, okay? So one of us is always on call, okay? So when you call the office and not after working hours, you put you in contact with that provider, you explain what are the things that are worrisome, what are you worried about, what are the things that you're concerned, and we'll let you know what to do. The answer might be, yes, you need to go to the emergency room. But then you're gonna go to emergency room that I have privileges in, and I can go and see you. The problem is if you go to a hospital that I don't have privileges in, then I'm not gonna be able to see you in the hospital, and just things get a little bit more complicated. It's better if we could have it that way. And most of the time, most of the time, there are things that we can do and we can see you in the office the next day. Usually that's the case. But if it's an emergency, it's an emergency, okay? So those are the most important things. I put the phone number here. You all should have our phone number. This is our office phone number. So that's the way of getting in contact with us, okay? Anything else, Raquel?
No.
We're good? We're good? We'll take some questions.
Yes.
Thank you guys for watching us on YouTube, and thank you, Raquel, for joining me.
No, thank you. Bye, guys.
Bye.